Hi there. Our next case is a 52-year-old beautiful young woman who has upper eyelid excessive skin, muscle, and fatty tissue. And what you see, what happens to people as they age, in some cases, as the brow kind of goes from a higher position to a lower position, this extra skin here becomes less elastic, and sometimes a little extra fat can be deposited there. It gives a lateral kind of slant to the eyelids, which creates a more sad appearance. So go ahead and close your eye for me. What we're going to be doing today is taking a pretty substantial amount of extra skin out here, extending from the medial side all the way laterally here. We'll also remove some of the superficial muscle in there, the one that can cause you to constrict the eye a little bit, and also some of the fatty tissue in here to try to open up her eyelids. We're going to do it all under local anesthesia, and it should make a big difference for her.